Hi everybody, Neil Kravitz here. I hope you're enjoying these daily clinical pearls. I just got back from Kansas City late last night. I had a great lecture. I met so many fantastic orthodontists there. This pearl comes from a previous video, a question that I just received about how I manage unwanted dental side effects from OSA appliances. So sleep apnea appliances are really snoring appliances. If they are very bulky and they really advance the mandible aggressively, prolonged use can cause the teeth to move unwantedly, and you can get a challenging dual bite. And one way to manage that is a pearl that I learned from Alfred Griffin II. Many of you guys know Alfred Griffin III. AG3 is the inventor of light force. Well, his father, AG2, is a tremendous orthodontist and member of our Edward Engel Society in Virginia. And he has this great pearl where he also gives patients a passive tooth positioner set in maximum intercuspation. We don't want to align the teeth, because if we align the teeth, then the snoring appliance will not work. But it's a passive positioner where the patient wears it for about 10 to 15 minutes in the morning to reset the bite and eliminate the dual bite. So the pearl here from Dr. Griffin is to also give the patient a passive tooth positioner if you give them an OSA dental appliance. And remember from previous videos, these appliances are much less effective than CPAP. A secondary pearl that I'd like to add is if you or your spouse would benefit from a sleep apnea appliance or a snoring appliance, I highly recommend the Zyppah appliance. It's Happy Z spelled backwards. It's sold on Amazon. It's about $100. It's a simple mouthpiece. It's so innocuous. I do not think it would cause any unwanted dental side effects. So a tooth positioner may not even be necessary. But it's probably less effective than maybe a Somnomed or highly effective sleep apnea appliance. But this Zyppah appliance is very inexpensive. It's very cheap. I always recommend it to patients. It has an elastic band that pulls the tongue forward, and it's just a wonderful, inexpensive dental appliance for patients who sleep a little bit loud. And I highly recommend it to all of my patients, and they seem to all love it as well. So ideally, again, we're going to use a CPAP. Ideally, if that doesn't work, we're going to do a double jaw advancement surgery. But if a patient is going to use a bulky and strong dental appliance to move the mandible forward, such as a Somnomed appliance, are very effective. They can cause the teeth to move unwantedly. Also give those patients a secondary appliance, a passive tooth positioner. And if none of those things are what you want to do, and you want to do something very simple, try just recommending the Zyppah appliance. It works pretty well for patients who snore at night. Thank you guys so much for subscribing to this page. I hope you enjoyed it. Thank you guys for supporting the JCO.